you can say that you know you are a woman, therefore you ought to be one, but no woman I've ever asked has been able to tell me what that means, and I doubt that transsexuals will be the first to define it. Therefore, they are telling you one way or another that they're confused and unhappy.
That was Dr. Jeanne Hoff, a psychiatrist, talking about the problems of the transsexual on our program, Not for Women Only. Dr. Hoff, a transsexual, later spoke to us about his own problems on an important evening, the evening of a major operation which was to change his body from male to female.
This is a rare opportunity to get to know somebody you might not otherwise meet, a person in transition. We're going to see Dr. Jeanne Hoff in 3 stages, before, during, and after. It's a personal look into the life of a transsexual by someone who is, of course, uniquely qualified to discuss the subject. Now, to some people, this may seem unpleasant or even threatening, but it is deeply moving, and I think it can add to our understanding of other human beings, because one person's search for sexual identity, however extreme, has broader implications for all of our sexuality. Join us in a moment with Dr. Jeanne Hoff.
Eugene, tomorrow is the important day, the culmination, but there's been a timetable. One doesn't just go in and make a decision and go into this kind of surgery. When did it begin, and what has happened up to now?
About 16 months ago, I was surgically castrated.
What does that involve?
Well, it's not a very complicated operation. It's removal of the testicles, and in present day, it's usually done at the same time as the surgery that I'm going to have tomorrow, the vaginoplasty. But anyway, cautiously, I started taking hormones. I started the very important part of telling other people about what I was doing, my family and close friends, explaining to them as much as I could why my back was finally against the wall and I had to do something. I'm quite frightened about the surgery. I've had enough painful procedures in the past, and I admit I'm a sissy about pain. In addition, I have lots of loving friends and relatives and supporters, and they've all been, for the most part, they've really been very nice. But it's a very lonely moment indeed. I don't quite know how to describe it. The things that transsexuals, that those of us in whom these urges are very polarized and intense, the things that we do to our bodies and our lives are very disturbing to the people around us. And I can see that fear and that confusion written on their face, even when they've known me for a long time. And it's not there when things are going along as they expect, but it's there at acute moments like this. You can almost hear them saying, I'm really on your side, but I didn't really think you'd do this.
What about your family? They know about you, obviously, but do they think of you as a son doing strange things?
Well, we haven't sort of posed that question so straightforwardly in recent years. Their son was always doing strange things. I was an effeminate child. I was sensitive about some things that are oversensitive in their view, perhaps. And I think probably the poor dears always found me a handful in one way or another, and still do. Their immediate responses to hearing about this 4 years ago were not very supportive. Since then, they've learned to, I think, adjust to it somewhat. Bear in mind, the presence of a problem like this seldom really makes sense even to the person who has it. Mine doesn't make sense to me. I don't know why I have it. It's a phenomenon that I'm trying to deal with. And I've been thinking about it every day for 39 years now. You can't load this onto someone else, particularly someone who loves you, and expect them to get their head around it promptly.
Why are you talking about this going public when you know such publicity could be adverse, such as the publicity that was received by Renee Richards?
When I started trying to resolve this problem rather than put it in the back of my mind, I had some trouble finding doctors who could help me. I had to go very long distances and spend a lot of money at a time when I didn't have any. I think it ought to be true that more doctors know what's going on with transsexuals, and that they know more than this idiotically simple, highly publicized classical story. The doctors know the classical story, and more the pity the patients know the classical story, and they always get it exactly right when they come to you, because they have not gotten it right in some previous doctor, and he's ushered them out of their office saying, you're not a transsexual, you don't want to cut off your genitals, you don't think you're a woman trapped in a man's body, and all this other stuff. I have a large practice of transsexuals and transvestites and homosexuals and people with medical impotence problems and things of that sort. So I have a large body of information which I want to make available to people, and there are only so many ways of doing it. Another reason is that in spite of the fact that one of the big penalties in life for me has been that I've always been more visible than I cared to be, and not admirably visible, I thought. It's not possible for me to insist to my patients they do this sort of thing openly and confidently without doing it that way myself. I went through a phase where I had made promises to be secretive about this. As a matter of fact, I've only recently outlived those promises. But I never liked it. I can't see exchanging one nasty secret for another, or recommending to people that they live a life, a closeted life of shame, when I think there is no moral content to this. People with sexual or gender problems of any sort, even very pedestrian ones, go through a period of feeling quite alone. And it's so sad. We don't tell one another what's going on. We tell one another lies, as a matter of fact.
When did you first feel uncomfortable with your own body?
I don't remember looking in mirrors. I don't remember, except where necessity dictated, to shave. I don't remember ever feeling that I could dress comfortably or that I was appropriate in any sense.
Can you tell us the difference between a homosexual, a transsexual, and whether you had any feelings in either direction, whether you were confused about these two at any point in your life?
I thought all those years that I was the only homosexual on earth. I'd never met another one until I was 35, because I didn't know what homosexuals were, I think. My view was that people who wanted to be a different sex and do all the things that bothered me were homosexuals. I didn't know that there were any differences, which seemed like an incredible gap in my otherwise complete education to last so long. But in due time, I found out that there were differences. And I found out by trying to be homosexual and finding that, to my surprise, great surprise, since I think I invented guilt, I never felt guilty about it at all. I also didn't feel that it was the right thing or that it was satisfying. When I learned to relate affectionately and erotically to men and found out enough about it, I was despondent, because my very structured explanation of what was going on with me and how I would avoid it and live a moral life fell apart. I didn't feel bad about being homosexual. I just didn't feel that I was anymore once I knew what it was.
When we hear someone like yourself say that you're a woman trapped in a man's body, what would a chromosome test reveal?
Well, almost invariably, you are what you appear to be. You should really confine the word sex to refer to a person's reproductive function. And in general, that's related to his chromosome arrangement and number, but not always. There are some slip-ups. It isn't always even related to what his external body may have. There are some slip-ups there. You can be pretty sure that a person is male if he produces sperms and has fertilized a child, and a person is female if she produces eggs and nurtures the child in her womb. But there are some exceptions to what one might think are obvious correlations between that. Anyway, that's the only point at which the thing is, in any sense, clear-cut and polarized. The second thing, the gender role, is the set of behavioral characteristics, attitudes, modes of expression that you acquire that are in a primitive way related to your biological reproductive function. But in modern society, they're very, very derived from that. Many of the decisions about what is male and what is female are quite arbitrary, and they cross borders. So there is not just two genders, there's an immense, complicated array of them. The third thing, eroticism, is even less reliably related to your biological function. People become sexually aroused by things at all ages and for a variety of reasons. The perceptions that you make when you're an infant with nonverbal logic become incorporated into your adult eroticism. The perceptions and the needs that you have at every other age, with or without verbal logic, become incorporated into your eroticism. And by the time you're an adult, there's this immensely complicated fabric of things which you regard as repellent and stimulating sexually. None of it really needs to make any sense. Most of it is quite inaccessible. We abide by a certain number of conventions in terms of what we admit about our eroticism. But anyone who looks at any part of the underworld or reads its literature knows that there's a very, very widespread deviation from all these conventions. And that the things that are erotic to homosexuals, for example, exist in everyone. The things that are erotic to people who do things that you may regard as strange, like fetishists or people who make love to animals or voyeurs or exhibitionists. All of these things exist in some degree in many of us. Erotic feelings toward your proper, legal, socialized partner, your wife, your husband, as it may be, are not all that dissimilar from the erotic feelings you may feel for your mother, your father, your children, your neighbors, your male and female friends, your male and female siblings. Those feelings may be comparatively weak, and usually are, but they are there in all of us sometimes. And as far as I'm concerned, there is no moral content to the feelings being there. There may be moral content, and there certainly are some practical reasons for not acting upon all of those things. But all of these things which stir up me and other transsexuals and other people who are regarded as having sex or gender or eroticism problems are there in everyone. It's just a matter of degree.
What do you feel you are now? Do you feel you are a woman?
I am not a man in any sense that I was ever able to feel comfortable with it. I'm not a woman in conventional public sense. There's always some level at which a transsexual doesn't make it to the other sex. But functionally, I'm getting nearer and nearer to something that I can live with comfortably, and that's more woman than man.
Have you ever had an erotic experience with a woman, or have you ever wanted to?
I don't remember any such time. I like women very much, and I've had interesting and very loving women friends. You are more a woman than a man, and I can only think of you as she. Puzzling, isn't it?
No, it is puzzling, but what I wonder now is when you've had the surgery, will you dress as a woman all the time?
When I'm dressed this way or more mannishly for practical requirements of my life at the moment, I think more people think I'm a man than a woman, but people stop me on the street once in a while and ask, and patients will ask once in a while. When I'm dressed as a woman, when I've been doing it for some days in a row so that my mindset can change, I think I'm reasonably persuasive. The longer you do it, the more you do about the cosmetic things. the more electrolysis I have, the more confidence I gain, the easier and more realistic it becomes.
Your job will continue, the same job, presumably?
Oh, yes. It's fortunate, in one sense, for a doctor, because I have a past which can be transferred over. Many transsexuals try to make their present and future with a secret past. And of course, when you have no credentials, you have to take very ordinary jobs, even though you may be qualified for something else. I don't choose to do that, and so far I haven't been interfered with.
Do you have a current relationship with a man that you hope will continue after the operation?
I have a current relationship with a man, and I'm not sure whether he'll be able to survive this. The people who fall in love with transsexuals are very interesting. The reason I know some of those things I said to you before about human sexuality being so variable and not polarized is, among other things, I've been able to view the people who fall in love with transsexuals. They're not straight, they're not gay, and they're not bisexual. They're people who learn to love man-women, to learn to love the in-betweens that we are for part of our life and maybe in some sense all of our life.
Can you imagine a longer relationship, getting married?
The marriage market for middle-aged spinsters is not a bull market, and I'm not going to die of grief if it doesn't happen to me. I have an interesting occupation. I have a full life with friends who are affectionate and caring, except at very lonely moments like this. They withdraw a little bit. It doesn't matter, I understand. That's very much better than life was before. And I don't know that anyone is entitled to ask for everything. The child in me certainly asks for everything regularly, but that child has learned to face compromises. I don't regard things as a total failure anymore if they aren't eternal. I'm, after 35 years of being, by all appearances, aloof, I'm very glad to have loving intervals in my life that last a year or two or a month. They're delicious, and I'm quite unaccustomed to them.
The next morning, I went to the hospital in Queens to record the vaginoplasty, an operation which lasted for 2 hours and literally transforms the penis into a vagina. I spoke to Jeanne.
Actually, I'm feeling quite good. I was a little edgy last night. I had a good cry before I went to bed. But that's all over now.
Good. And you're all set then?
Yes. Good.
Okay.
That would be wonderful. Thank you.
All right, you go to sleep now. We'll see you a little later then.
Bye.
Okay?
Thank you.
Good. Dr. Robert Granato, a urologist who performs the operation, explains the serious nature of the surgery.
It's not such a major form of surgery. It's a major responsibility, it's a major decision, a major undertaking, but not major surgery. I mean, no more major than a gastrectomy or cholecystectomy.
Is there any possibility of a reversal? Has anything like this ever happened?
Thank goodness I never had a case who repented, following the operation. It's a long preparation. The patient is submitted to a study by a medical team, of which the psychiatry is the most important element. We have to be absolutely sure that we are dealing with a true transsexual.
You call a transsexual a her?
If I don't think that these are hers, I could not do the operation. I believe that there are, as the cliche goes, women trapped into men's bodies. And when psychiatrists cannot adjust the mind to their body, in order to obtain an equilibrium, we adjust the body to their minds.
In this kind of procedure, what do you actually do and how long does it take?
This is the final step of the surgical management of the patient. And it entails the removal of the innermost part of the male organ, preserving the skin. Then we create a cavity between the anterior wall of the rectum and the posterior wall of the bladder, and we line up the new cavity, which is the new vagina, with skin we obtain from the penile skin. In some cases, the organ is not long enough or large enough, so we have to apply a skin graft to provide with a normal size vagina.
Now I will take it, slide it over like this.
Poor little turkey went to his early death, Tori, but he was glad to do it.
It is now 2 months since the surgery, and Frank and I are back to see Dr. Hoff. We are curious to know how the changes have affected her. Jeanne has insisted that we have luncheon rather than another formal interview.
Have you, Jeanne, physically changed? It's what, 2 months since the surgery. Have you felt any physical changes? Your body, your breasts, the hair growth?
No, things like that don't happen so quickly. They happen over the course of years or decades, and are largely the influence of hormones, and they have happened to me over the course of the past 4 years. I'm giving away all my old clothes because I can't get them over my hips anymore, even though I've basically lost weight. Body hair decreases slowly, except for facial hair, which has to be removed by electrolysis. So there are no dramatic changes of that sort.
Jeanne, do you feel that now after the surgery you accomplished it? Do you feel you have a woman's body?
Yes,
do you like it any more than
I love it. It's just beautiful, and I'm so glad to be out from under the confusion of the other.
Are you dressing as a woman all the time now?
I'm dressing as me all the time, which most of the time means blue jeans and a blouse. You will seldom see me in this much war paint and gear in the future. The process by which transsexuals change their gender role now is guarded by a lot of patient and dear doctors, but all of whom have fairly conventional views of what a woman may do and look like. And so we're all heavily muscled into makeup and flimsy dresses and things when it isn't suitable all around. Once the process has gotten as far as it has with me, however, you can afford to be a little bit independent because they can't change you back. From the skin down, I am just right. From the skin out, I have yet to find the optimum way to live, but that will come.
Did you have anything done to your breasts?
Yes, I had little implants put in.
Implants?
Yes, the surgeon was amazed that I didn't want to be a showgirl. He was kind of disappointed. That's part of it, I think. When they offer to help in this way, they usually think that you want something quite theatrical, which I didn't want and didn't think was suitable for my physique. But his view of what would be a nice result was greatly in excess of what I thought I could deal with. So we compromised and did it my way.
do your friends feel differently or behave differently towards you now?
They treated me like a toy for the time that I was in the hospital, and now they're getting back to normal, I suppose. I think you'd probably have to ask them.
How was your personal life? Your cooking certainly has improved.
Thank you very much.
Last time we were here, we
weren't offered a thing.
Do you find you tend more now toward the feminine? Do you do less masculine things?
Well, I'm still repairing the house, and I'll continue to do that. I've always cooked. It was a matter of learning to cook or dying when I lived in my first apartment. Now, I do things that I enjoy without designating them as having one gender role or another. But I think these distinctions are quite false. And I don't mean to be a living representation of what I regard as a useless way to categorize things. I think men should cook and women should cook and men should sew and be self-sufficient. I do all of those things because I think they're fun, as time permits, of course.
Last time we were here, we asked you about a relationship with a specific man. You were worried it might not survive the surgery. Has it?
I'm not sure that we have a future in that sense. But insofar as we have a present, it's holding up as far as I can tell.
How about your patients now? Is there any change in their attitude towards you? They confided in you, presumably, thinking of you as a man, but with the same problem that they had.
Yes.
And now here you are.
Most of them are quite happy that it happened. They say in many cases that it was overdue, which is the way I feel about it. And they don't seem to be having any difficulty, quite the opposite.
Well, now, Jeanne, do you feel that you are now a woman, whatever the term means, full woman, or do you feel there's something else that has to come?
I need some past history as a woman before I feel that I'm close enough. It's a brand new situation for me, and I think it will settle in. I'm getting nearer, I believe.
Can you imagine in the future adopting a child?
Yes, I think that might be a nice experience for me. I like children very much. I think there will be obstacles because people with more straightforward histories than mine meet them constantly. And every step that's taken officially or unofficially to make life harder seems to me to be doing the wrong thing. Even supposing it were possible to cure people like me of my basic needs, and it isn't, it's been tried, or to cure straightforwardly homosexual people, they wouldn't all get well today, and they have to work somewhere and live somewhere, and go to school between now and then.
Jeanne, how do you want us to accept you? What can we do?
Well, it may not be necessary for you to go to a lot of trouble to learn about accepting transsexuals if you have a general principle, and that is mind your own business, I suppose. It boils down to that. If you are meddling in the life and freedom of someone else, you ought to do so very cautiously and make sure that you're entitled to do so and that they'll be better off for you having been there. Some psychiatrists learn soon, and all I hope learn eventually, that you must not meddle destructively in people's lives. We don't have as much power over people as we would like sometimes, fortunately, but we sometimes have a great deal of power to mess them up, and you have to be very careful not to do that. You leave little footprints on people's minds that are very hard to erase, and so unnecessarily. I suppose we all have to drink some water from the well of despair, but so many of us drink so liberally, and it's poured on us in some cases. It's not necessary. It's just not necessary. So if you take the position that people are all right until they have proved that they're not, you're not likely to harm me. And I'll do my best to justify that confidence.